Eric Greco here with breaking news. Quinnipiac fraternity found itself in a midst of a pertussis outbreak. I'll throw it out to Eric Greco for more details of the story. Reporting live at the Phi Gamma Tau fraternity house. We are about to interview one of the fraternity brothers here at the fraternity house. This is the Phi Gamma Tau fraternity house reporting live.
Hello?
Sir, is this the Phi Gamma Tau fraternity house?
Yes.
How have you been feeling, sir?
I've had a little bit of fever, runny nose, a little bit of cough, nothing too bad. Why?
How have the rest of your brothers been feeling?
A couple of them feeling pretty bad. Some are coughing up mucus, runny noses, really bad cough too, like really, really heavy cough.
Are you aware that 6 of your fraternity brothers have been hospitalized due to this cough?
I knew they went to the hospital, but not because of the cough.
Have you been vaccinated against pertussis?
Nah, I just take Advil.
Audio Jungle.
So, Dr. Lena Paul, how have you been treating the recent pertussis outbreak at Quinnipiac University?
Well, with pertussis, we tend to prescribe 3 antibiotics, azithromycin, clarithromycin, and erythromycin. We recommend that infants receive the DTaP vaccine, which is a series of 5 vaccines administered at different ranges. The first dose is at 2 months, and then it is at 2-month intervals.
So, if you had to say if there was an easier way to prevent the outbreak of pertussis at Quinnipiac, what would you recommend?
Well, in the case of the Quinnipiac outbreak, the Tdap vaccine would be used because recipients are over 10 years old. That's kind of what we recommend.
Okay. So, a lot of people always talk about the negative side effects, and the press usually take hold of, this is what will happen if you get this vaccine. So, what are some advantages of getting the vaccine?
So some advantages are the side effects are minimal. There has been some pain, redness at the injection site, sometimes vomiting and mild fever. It is also possible to have severe and some rare side effects.
Interesting. Hello, I'm here with Anna, and she's here to discuss the benefits of getting the pertussis idea and debunk the myths and misconceptions of receiving the pertussis vaccine. Anna, please.
All right. Well, one of the first things that we should talk about is that vaccines, most people think that they cause autism, and that is actually a big lie. That's not true. Although there was a study that was done by Andrew Wakefield that stated that vaccines cause autism, he actually ended up not using a viable population, and it was also found that some of his data was incorrect, so that any results caused from that, or any results taken from that study aren't true. So although the media has blown it up, and there's many celebrity endorsers that say that autism has that their kids have gotten autism from vaccines, it's not true. Autism isn't something that comes from vaccines. As a professional, I recommend vaccines because not only are they helpful in preventing diseases in communities, but it also keeps your child safe from children who aren't vaccinated or people who cannot be vaccinated. Another misconception that's found is that DTaP vaccines are decreased, and if you decrease the DTaP vaccine, the immune system will receive multiplication. And even though the doses for the DTaP vaccine, there's only 5 of them, the 5 doses are recommended by the CDC and the time intervals that they are, because it's been found through many experiments and trials that those are the age groups that are the most effective, and that's the most effective way to gain immunity. Another misconception is that SIDS, sudden infant death syndrome, is caused by vaccines. This is also something that's been debunked because that's something that could happen whether or not you're going to get the vaccine or not. Like, your child could have been in the process of getting that vaccine, but then could go into sudden death syndrome, and there was nothing that could have stopped that. It would have just happened anyway if you didn't get the vaccine. Some hot topics that are related to this vaccine are that.
So, Anna, if I can ask you, there's been a lot of skepticism on if pregnant women had the vaccine, how would that affect their children and the results of their pregnancy?
It is actually found to be okay for a pregnant woman to get the DTaP vaccine, although there's a lot of controversy on it and the media does blow it up. It's been found that women can be vaccinated in the late second trimester, and it's actually recommended. Not only will that protect the mother from when the baby is born, if the mother happens to get the virus, the baby's protected. And also the mother should be protected along with most other members of the family, just in case somebody doesn't come in contact with the virus. That way the infants protect them as well. Because obviously they're too young to get vaccinated, which is another reason vaccines are so important.
Wow, thank you for clearing that up. We've had a lot of questions about the misconceptions of pregnant women. So now leading to something further than that, what would you say about getting the vaccine in older age? As if they haven't had it, would you still recommend that they do receive it, even if they are older in age?
I would recommend for anyone to get a vaccine, no matter the age, unless you're immunocompromised or you're an infant who's just born. You obviously can't have it. But I would definitely recommend that if you're over the age of 65 that you get the vaccine, specifically the Tdap vaccine, for that is administered for people ages 10 and older. And also, if you've received the vaccine only has a lasting immunity period of 10 years. So after that, I would recommend to also get another booster so you can maintain that lifelong immunity against the disease.
Awesome. Well, I would like to thank Anna for coming on this segment tonight, and I think the final note is get the pertussis vaccine.
Audio Jungle.
Is this the
Hello?
Phi Delta Tau fraternity house, sir?
Yes?
We hear there's an outbreak of pertussis within the fraternity.
The kitty! No, she actually can't go out.